We are good to go. Welcome, everyone. Welcome to the Fixed Blood Sugar webinar. If this is your first time with us, you're in for a treat. Thank you so much for joining us. Last time we completely filled to the max, and so we weren't even able to let new people in. So we'll see what happens today. But those of you who are here early, you made it. You made the cut.
You win.
So Joel won't be with us today. Actually, he could pop on. I'm not sure. I think he's traveling. So it'll be Dr. Saunders and I. And today we're going to be talking about type 2 medications. So this comes up a lot. I know we get a lot of questions about this. And so one of the things that I'm hoping you guys can do, whether you're on Facebook or you're watching this live, is to comment if you're comfortable commenting with some of the medications that you're taking. And what I would love to hear from Dr. Saunders is just what is the process when someone, first discovers that they have type 2, what usually happens, maybe not with you, but with a typical doctor. They go into the office, they have a type 2. What program are they put on? And I'm just kind of curious how that works. And I want to see if that relates to a lot of the people who are hopping on today. And then we're going to chat a little bit about what we are finding success with, not me, Dr. Saunders, and the Barton team with our diabetes solution kit. And if that's any different than what doctors typically use. So we also want to just put a quick disclaimer out there. Yes, Dr. Saunders is a medical doctor, but everyone is different. And so actually, maybe I should let you tell this. I'll let you finish the disclaimer, Dr. Saunders.
Starting with everyone is different.
Yes.
Okay. What I give is general information here. We're not like one-on-one in my office, and I don't have your test results to tell you, oh, you need to do this and you need to do this. What I'm saying is this is general information, and it may apply to you and it may not apply to you. So that's where you go with your healthcare professional, you get tests done and you say, oh, this would be a good thing for me, or this other thing would be a good thing for me. So as today we talk about medications, one thing that we don't want is for you to just go, oh, Dr. Saunders said that medication has these side effects. I don't want those. So boom, I quit my medication. That wouldn't be a wise thing. What you'd want to do is say, maybe I want to get off that. So let me talk to my doctor who prescribed it and find out if there's alternatives, or find out how I can do that. Okay. That would be the best way to handle it.
Great. And as we're chatting, if things come up, guys, and you have questions, feel free to ask those in the Q&A or on Facebook in the comments, or we will try to get to as many of those as possible. So let's go ahead and get started, and let's chat about a typical maybe office visit where someone finds out that they have type 2. What usually happens, and what are they typically prescribed?
Okay, so you go into your doctor and you say, I have to get up at night like 5 times to urinate, and I don't know what's going on. And doctor says, that's called diabetes, and let's do some tests. So that you do some tests and you find out your hemoglobin A1C is like 9. And the doctor, so you come back to the doctor and the doctor says, you have diabetes. And so here's what you're going to do. You're going to see the nutritionist, and you're going to start on these medications. Typically, it should be one medication to start with, and not more than one, because if you have a bad reaction and you're taking 2 at the same time, you don't know which one it is. And then both of those are out. You can never try either one of them because it can come. Sorry. Sorry, I got to keep my phone nearby so that doesn't happen. So you start on one medication and you take that for a little while, whatever that is, and then you come back and you start checking your blood sugar, and you come back with the numbers, and the numbers are maybe a little bit better, and then that may be a good place to start, or maybe not. So that's the way it's usually handled. And then so if your blood sugar isn't controlled on one medication, then instead of like taking you off the old one that wasn't working, they'll usually give you another one to add on top of it. And then if that isn't working, then another one to add on top of that. And I've had people on 4 different diabetes medications and then injecting insulin to try to control blood sugar. So it's so we're not taught as doctors to say, oh, that medication isn't working, let's stop that one and try a different one. And that would be the same with blood pressure. They do the same thing. That's the way we're taught to do things. Is if this medication isn't working, just add another one on top, which of course increases side effect risks of getting low blood sugar or having some other side effect of the medication. So typically then you'll be started on 1 and then 2 and then 3. And then as you see the doctor, they just add on more medications. And so, you may end up on multiple medications. And then if you say, gee, I'm having side effects, I want to get off of these, then, which one's causing the side effects, or is it the combination of them? That's not an easy thing to know. So that's the way it works.
Okay, very interesting. I'm going to go ahead and just read a couple comments. So Mary said she's been on 500 milligrams of metformin for several years. And we do hear a lot about metformin. It seems to be a pretty common thing that people message us about. David says, I have reduced a lot, but I'm taking either Amaryl 2 milligrams or 500 metformin, or sometimes only metformin. I adjust it based on how I am doing with blood sugar. Here in Colombia, it is not a prescription drug, so I just buy it at the pharmacy, as my original prescriptions were a lot higher. Very interesting. Scott says, I've been in phase 1 in ketosis for 1 year, and I'm still taking metformin and Farxiga to bring my blood sugar numbers down. Okay. David said, my doctor prescribed 10 milligrams of Amaryl and eventually insulin. Okay. So this is interesting. All right, this is good. We got some of these in the chat here. Chris says, I have short questions about cardiovascular health and type 2 diabetics. Yeah, feel free to send those questions in, Krish. Let's see. All right, Jim has a question. I'm jumping right into these questions because this is good. Jim says, why does my blood sugar level rise overnight? I went to bed with my blood sugar at 125, woke up with it at 164. I didn't eat at 6 p.m. and I only drank water before going to bed.
Okay. The reason is because there are so many factors that enter into what your blood sugar or why your blood sugar goes up. It's not just what you eat that makes the blood sugar go up. You actually have mechanisms in your body to keep your blood sugar at a certain range all the time. And so if it starts dropping too low, then you'll release glucagon from your pancreas, and that glucagon will then cause your liver to make more sugar. So then your sugar will actually go up even though you haven't eaten, or even because you haven't eaten anything and your blood sugar is going lower than expected, and so you release it. That's okay. Don't worry about that. In fact, that's a good thing. That's a normal mechanism. And what happens is when you've had diabetes for a while and your blood sugar is, consistently in the, let's say, 160 range, for example, that's sort of reset your normal blood sugar. And so you start dropping into the 110s and 120s, which for everybody else is still high, but for you that would be low. So then you release this glucagon, and then your body brings the blood sugar back up again to where it's supposed to be at the set point. That's why we do the phase 1 of the program. Phase 1, during this period of time, you remove all the carbohydrates and get your blood sugar down, 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 down. And what's going to happen is you're going to use up all of that extra glycogen that you've stored. And so it'll open up the insulin receptors and allow sugar to get into the cells again. And so you'll be able to manage that better over time. So if you've had this for a long period of time and you have a high set point like 200, that could take a while to get your new set point down to where it's supposed to be in the 70 to 90 range. That's why. So it's a normal mechanism. Don't worry about it. Just stay on that ketogenic program, the phase 1 of the book. And it will gradually come down. For some people, it's a matter of weeks because they don't have a high set point. For others, of course, it's going to be months because they have a high set point.
Okay. And if you're new here and you're not familiar with the Diabetes Solution Kit, you can find that at bartonwebinar.com. I'll post that in the chat. But in the Diabetes Solution Kit, we go through, like you said, phase 1, where you're limiting your carbs, and we walk you through that. There's recipes, etc. But it's a really good program. It's helped a lot of people. In fact, Paul, I'm curious, you had commented, I just went to my doctor and he says that I've lost a lot of weight. Was that a good thing? Was he happy with that? I'm not sure what your status was, and let us know if you're doing the Diabetes Solution Kit. And if you have type 2, so let us know that. And Sir Charles has a question here. He says, please refresh me on the subject of heart rate. What is good and what is not good?
Oh, heart rate. That's good. Okay. So if you are a marathon runner, your heart rate will tend to be in the 50s. I've seen people as low as in the 40s. And I listen to their heart and it's going boom, 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 boom. And I'm like, come on, keep going, keep going. It feels like this is too slow. Because I'm used to 80s where it's going boom, 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 boom,
yeah.
boom, boom, boom. So so your heart rate, it does have something to do with your cardiovascular, your exercise, how your heart functions. So if it's over 100, that's too high. That's like, if you're resting and your heart rate's over 100, then there's something wrong with the heart function. And that's called tachycardia. And sometimes it's because the rhythm is off. It's an arrhythmia like atrial fibrillation, those or other arrhythmias. Arrhythmia just means an irregular or the wrong rhythm is what it is. It's not rhythmic. It's not doing it on a regular basis. But a normal heart rate would be 60, 70, 80, somewhere in there. And that's going to go up and down depending on what you're doing. So even just thinking, if you think about something really stressful, like back when you were in an accident or something, and you remember that event, your heart rate could start going up just by thinking about it, by thinking about something. On the other hand, if you start your meditation and you totally relax and let go of everything, you can bring your heart rate down pretty low into the 50s, maybe. So a heart rate does have something to do with your cardiovascular abilities, but it's not your fitness, for example. But it's not necessarily always has to be, in a certain range. It can go way up and way down. That's okay. So if you're running and it goes up to 120, great. But if you're sitting and relaxed and it goes up to 120, something's wrong.
Sure. Okay. Coney says, Dr. Saunders, please tell me what doctor I need to see about my thumb and the next 2 fingers that are numb and hurt. Thanks so much for doing Thursday mornings and answering our questions.
Ooh, good question. Okay. So these 3 fingers, there's a very specific nerve called the median nerve that serves these three fingers. The median nerve is in your wrist. So that nerve goes through a tunnel called the carpal tunnel. And that carpal are the bones. There's 7 bones here in the wrist. And this nerve goes right through a tunnel in those bones. It's not a problem at all, usually. But when the tendons that flex your fingers, that allow you to grab on and hold on to things, sometimes those tendons in the wrist get inflamed and they swell up. And because that tunnel is going through bones, there's no give. It can't expand out. Like these tendons, if you have this tendon right here, if that gets inflamed, yeah, that might hurt to touch, but it just makes the skin pop up a little bit, and it's not going to do anything. But when you're going through a tunnel of bones, and now you have 2, and then you have that nerve squeezed in there, what happens is it squeezes in on the nerve, and it makes these 3 fingers go numb and tender. So that's called carpal tunnel syndrome. So the type of person, the doctor you need to see would be a hand surgeon. But before you see the hand surgeon, try something natural. There's a reason why the tendons are inflamed. So normally what they'll do is they'll cut the ligaments that hold the bones together to allow more space in there, so that as the tendons get bigger, then the nerve has more space and doesn't get pinched. And that works sometimes, not all the time. A better thing to do is to find out why you have the tendinitis in the first place and deal with the inflammation of the tendon. So have some tests done. How much inflammation do you have? Why do you have inflammation? Could you use something like turmeric, pycnogenol, or boswellia? Boswellia is a frankincense. Turmeric is curcumin. And those kinds of things, if you can get the inflammation down, then you can get the nerve so it's not pinched anymore, so there's more space for it, and then it'll work and you won't have that issue anymore.
Let's see. Paul, I forgot I was muted. Paul had said, I just went to my doctor and he said he had lost a lot of weight. He also wants to know how he can stop losing more weight and still stay in phase 1.
Wow. Okay. Well, you can do a ketogenic diet. You don't have to lose weight doing it. By eating more, essentially, in phase 1. There's a sort of a point at which you're not going to lose weight very easily as long as you're eating sufficient. So getting enough, people on carnivore diets can lose weight at first, but after a while it's like a curve where you lose weight quickly. The same kind of thing happens with the ketogenic diet, or even if you're going the other way and doing a low fat diet, you'll lose weight quickly and then you'll stop losing weight. And that would be by eating more frequently or by eating larger amounts.
Okay. And I also was curious too, I'm assuming you have type 2 then. I just wanted to confirm that. Okay. Let's see. Coney says, I'm having a hard time not eating and only drinking juice, bone broth, and water. So you must be doing some type of a fast. And I'm curious what kind of juice you're drinking. Is that okay to ask?
Of course.
Let's see. We'll see what he says. Okay. Lisa says, your thoughts about using Ozempic. Are you familiar with that at all?
I'm not even familiar with that.
Okay.
Ozempic. Okay. Huh.
Let us know what that is. Let's see here. Anku says, Dr. Saunders, how does intermittent fasting help in reversing type 2 diabetes?
Okay. When you have an empty stomach, you repair your intestines. You start using up all of the things that you have been storing for all these years. So having an empty stomach is cleaning out, and diabetes is just toxicity. So the best way to look at diabetes is just having calorie toxicity. And calorie toxicity is carbohydrates, fats, and proteins. So when you're not taking in carbohydrates, fats, and proteins, you still need them. So you start using up all the stored stuff that you have all over the place. And those stored calories, as they're getting used up, you're getting more insulin sensitive. The insulin starts working better. The cells start working better. The nerves start working better. Everything starts getting fixed when you're not eating. So having an empty stomach, for as much as you want to have an empty stomach, is a great way to detox. In fact, it's really the only way. So intermittent fasting is a great way to do that.
A question from Krish. I have a blood cholesterol level of 202, but my HDL, LDL, and triglycerides are excellent and within normal range. Why should one take, well, let's see here, rosuvastatin and ubiquinol? Thanks. I understand we need cholesterol for the synthesis of any hormones. That was the basis of my question.
Yeah. So rosuvastatin is rosuvastatin is a pretty potent cholesterol inhibitor. What it does is it stops your body from making cholesterol. And cholesterol is absolutely necessary for every cell in your body. If you don't have cholesterol, you die faster than if I take all the oxygen out of the environment. Cholesterol is that important. Your brain is made out of cholesterol. So it's something that you have to have. And rosuvastatin blocks it. Blocks your body from making it. So your cells can't make cholesterol. Which in a way is okay, and it does lower certain things that cholesterol is made out of, or that is made into, that create inflammation, for example. But there are better ways of doing that, because the side effects of this are you don't make cells as fast. You don't make all the steroid hormones, and steroid hormones are really important, like testosterone and cholesterol and progesterone and pregnenolone and all of the things that keep your body functioning. These hormones are made out of cholesterol. And so if you drop your cholesterol, there's been studies done that in men, if you drop the cholesterol, you drop the testosterone, pretty much drops right along with it. So it's not necessarily a good thing to lower your cholesterol. But what you want is an optimal range of cholesterol to where your cells function best. And that's really interesting if you look at the total cholesterol versus the death rate. If you've ever seen any of those graphs, the largest study ever done on cholesterol was in Korea, where they took 12 million adults. This isn't like 100 people. In most of the studies on drugs, they do 500 people or 1,000 people or whatever. This is 12 million adults, 12.8 million adults. And what they did is followed them along with what was the death rate versus their cholesterol level. And no matter what age, except for in young women, but besides that, almost every age, 220 is the optimum cholesterol. That's where you want to be. If you're lower than 220, you die faster. If you're higher than 220, you die faster. But in fact, if your cholesterol is 120, you die at a much higher rate than if your cholesterol is 300. So the lower is not the better, actually, in the real research, because that's been shown in the other research as well. So that's pretty consistent with all the research shows that there's a J curve, and that the death rate goes up with low cholesterol, goes up with high cholesterol, and then right in the middle. So that brings us back to your question. What about the rosuvastatin? What about the CoQ10 ubiquinol? Ubiquinol is very important. The body makes it, and if you take rosuvastatin, then that's one of the things that you can't make or inhibits, is inhibited by taking this drug. So there, at one point, there was, I think it was Pfizer, that patented a CoQ10 statin combination to be taken together, just one pill, so that you can get your CoQ10, your ubiquinol, at the same time you're taking your cholesterol medication. And they decided not to market it for whatever reason. Yes, that's one thing you should talk to your doctor about if you're taking any of those cholesterol medications. Is there an alternative? What's another way? And I'll just tell you just briefly, the best dietary way to manage cholesterol is a high fiber diet. So if you're on the ketogenic diet and you have high cholesterol, it may not be best for you to be eating all this saturated fat, like a bunch of butter and eggs and cheese and meat and all that stuff. You might want to switch more to the free foods, the broccoli and the lettuce and the celery and the cucumbers and peppers and all that stuff, and have more fiber in your diet, because fiber controls cholesterol so much better than any other way.
Today's Fixed Blood Sugar webinar is sponsored by Synachroma, our best-selling advanced blood sugar support formula. Now, thousands of people around the world are taking Synachroma every day as part of their program to fix their blood sugar using natural ingredients that simply work. Now, Dr. Saunders formulated Synachroma to meet key nutritional deficiencies that most people have unknowingly suffered from for far too long. With Synachroma, you get a blend of 6 key ingredients: the perfect combination of chromium, vitamin D3, and vitamin K2, which it's important to take those two together, selenium, vanadium, and our 10-to-1 cinnamon bark extract. Now, if you're not already using Synachroma, I highly recommend that you give it a try and see how it helps your energy, your weight, and your blood sugar numbers. You can get Synachroma at bartonnutrition.com or on Amazon. If you get it at bartonnutrition.com, you can enter the coupon code webinar25 and you'll save 25% off at bartonnutrition.com. But I realize some people like to go to Amazon as well. So anyways, Synachroma, highly recommend. Now let's get you back to the Fixed Blood Sugar webinar.
Okay, we have a question here. Let's see, from William. I had my CRP checked last month and it was 30. I forgot that earlier that day I was working on my property and stepped on a nail hidden under some black plastic. Fortunately, I have had Tdap. Would it be Tdap? Within 5 years.
That's a tetanus shot.
Right. So within 5 years, and have added immune support to my Synachroma and turmeric. Is this the reason my CRP was higher, or is it not related and something else? I will recheck in a couple months. Thanks.
Yes, recheck in a couple months. So CRP, a note about CRP. It could be because CRP can go up with injuries. It can go up with allergies. It can go up with infections of all kinds. So because the CRP is not specific to any one type of inflammation, in fact, things that we often don't even think of as inflammation, like diabetes, can cause CRP to go up, even though there's no real inflammation, because CRP is more related to cellular distress, which is partly inflammation, but there's other reasons for having cellular distress. So, for example, toxicities or nutrient deficiencies. So CRP is very non-specific and should not be used as to treat the CRP would not be wise. Really, what you're looking at is, okay, why is the CRP elevated? And so retesting is a good idea, because any of those things that increase inflammation could cause it.
Okay. Krish has one more question about Vascepa, and wondering what it is. I have not heard about it. Thanks. And I'm just pulled it up quickly. It says it's the first and only FDA approved medication to lower CV risk in addition to other medications. Actually, let's see. Such as statins in patients with high triglycerides and heart disease or diabetes with other CV risk factors.
Okay, what's the name of that medication?
Vascepa or Vascepa.
VES.
VASCEPA. It says icosapent ethyl.
Yeah, icosapent ethyl. Okay, it's an ethyl ester. It's a omega-3 oil, fatty acid, and it's fine. Omega-3 oils are just they're great. And there's all kinds of them. They can be made into DHA, EPA. You can take fish oil as well. There's a couple of prescription fish oil supplements, and they're fine. They're fine. You can take those, and there's really not a lot of risk to them. They help to manage the triglycerides pretty well, and they lower inflammation to some extent. So yeah, that's good.
Interesting. I didn't know that there were fish oil prescriptions or omega-3s. Okay. Sir Charles says, my blood sugar immediately after breakfast this morning was 112. Is that good for immediately after a meal?
Yeah, 112 is fine after a meal. Yeah, that's actually not even in the high range. So that's pretty good immediately after a meal.
Yes. All right. Susan says, what type of test tells you how much inflammation you have?
Well, CRP, we talked about. Use sedimentation rate is a good one. You can look at white blood cell count to some extent. And there's a couple of other ones, like ferritin is what's called an acute phase reactant, where there's if there's any kinds of inflammation or injury in the more recent kinds of things, then that will tend to show up. So those tests, C-reactive protein is one that's used most of the time because it's very broad spectrum and will get any kind of cellular distress. So it'll tell you there's something wrong. It doesn't tell you what's wrong. It just says there's something wrong. The other one is sedimentation rate, SED rate, or ESR. Those are the two most common ones.
Mike says, hello, everyone. Just wanted to say hello and thank you. Hello, Mike. Meg, this is a good question. How about the other two fingers? This is in reference to when you were talking about those three, the thumb and the two next to it. So what about the pinky and the ring finger? A little constant numbness, but no pain.
Okay. So if it's only these two fingers, it's an entirely different nerve. It's not the median nerve that goes through the wrist. It's the one that we call the funny bone. You know, when you hit your elbow just right between the bones there's a nerve that goes right along that. So that's I'm sorry. So that nerve feeds these two fingers and sometimes one side of this finger. It's not always exactly the same, but when you have a constant problem there, then that's where you look. Look for the nerve, and there's usually some inflammation in the elbow that will be producing that or causing that.
Right. Interesting. Okay. Great question from Anku. Let's see, what type of foods or what types of food increase our testosterone levels?
Oh, good question. I was just talking to somebody about that today. He's been on testosterone for a long time and he wants to get off it. He said, well, what can I do instead? Okay, there isn't like specific foods that really increase testosterone per se, but there are ways to inhibit the conversion of your testosterone into estrogen. So men want to keep a really good balance of estrogen low, testosterone high. And as we age, we tend to get like more of the estrogen, and that's where men get man boobs and the feminine kinds of like big hips and thighs and all that kind of stuff. And that's created primarily in belly fat. There's an enzyme in the belly fat that makes that conversion of testosterone into estrogen. And so having no belly fat is a great way to do that. However, there are some things you can do that also help. There's something called chrysin, which is an extract, CHRYSIN. Chrysin is something that inhibits that enzyme that converts the estrogen, or the testosterone, into estrogen. But cruciferous vegetables are a great way to maintain testosterone levels because they have I3C. And I3C is indole 3-carbinol is something that inhibits that enzyme that converts testosterone into estrogen. So high levels of broccoli, cauliflower, kale, cabbage, those kinds of things. Broccoli is really big for that. So those are the best foods to maintain your testosterone levels.
All right. Debbie says, I recently started giving plasma. My fasting glucose numbers in the AM have gone up. Is there something in that process itself, or is the saline that they return back into your blood affecting my numbers?
Well, that's a really interesting thing. I don't know. My best guess would be that there's when you're taking out a lot of the proteins and from the plasma, then you have to replace those, and your body starts replacing them. But there's a certain amount of stress involved with that, and stress releases cortisol. Cortisol makes you more insulin resistant, so the numbers will tend to jump up a little bit from that amount of stress. I suppose that would be my best guess. I don't know that there would be anything else, any other reasons. I mean, they're not really taking out significant hormones, or maybe there's something in the blood or in the plasma that's being removed that's necessary besides, like, creating stress. There might be something else. I don't know. Interesting. Never seen studies on that.
Okay, so Denise had asked the question about Ozempic.
Yes.
Okay, and so she has kind of two thoughts on this, but Ozempic is to help lower blood sugar and A1C, and it may help you lose some weight. And it lowers the risk of heart attack, stroke, or deaths in adults with type 2 diabetes and known heavy disease. My husband takes Ozempic injections. He also takes Jardiance, irbesartan, Synthroid, and an internist has prescribed those medications. Should he be seeing an endocrinologist instead? He has had type 2 diabetes for about 4 years. He's lost 28 pounds on phase 1. His blood sugar is between 85 and 95. He saw his doctor recently, and all of his lab work was not sent to the doctor. He does not want to take him off any of the meds until he sees him and all of the labs in 3 months.
Okay. Ozempic is the glucagon-like peptide analog. So it's a glucagon. It's similar to glucagon. It binds and it causes the release of more insulin. These are because of what they do. They cause more insulin resistance over time. So one of the things you don't want in type 2 diabetes is more insulin. What you want is less insulin. That's why when I was talking about the fasting, the intermittent fasting, one of the things that happens is the insulin comes down a lot, and then you release glucagon. So this stuff binds to the glucagon receptor and causes the pancreas to put out extra insulin. So the reason that's important is because immediately when you release insulin, your blood sugar comes down. Everybody goes, "Oh, good, my blood sugar's better." But what they're not seeing that over time, they're getting more and more resistant to insulin, because as they're stuffing more sugar into the cells are becoming more resistant. They're going to block the insulin receptors more. So then you need more insulin to get sugar into the cells. And then you need more insulin. Next thing you know, you're injecting insulin to try and get more, to try and stuff those cells full of sugar, but they're already stuffed full of sugar. And so, and they're blocking those receptors, saying, please, we're already toxic. We already have too much. And then you throw a drug in there that makes them more toxic. And that's where you get the toxicity from the drugs over time. And that's why these drugs don't decrease your risk of getting neuropathy or kidney disease. Still, even with all these wonderful drugs that supposedly work, diabetes is still the number one cause of blindness, the number one cause of dialysis and amputations of extremities. Things have not appreciably changed. In fact, they've gotten significantly worse. So the way out of that is to reverse the process, lower your insulin, and yes, I don't know that most endocrinologists are not really into helping you to reverse the process because they focus on the blood sugar and kind of think that the insulin, glucagon, all that's kind of irrelevant. Whatever we can do to lower blood sugar is going to work, even when it doesn't. So in helping you may need somebody who knows about this. So you look for somebody who does functional medicine, someone who can restore function instead of just working on the symptom of high blood sugar.
Okay. I think it's Stephanie. I am pre-diabetic, 6'4", for 3-month blood test, maybe 6.4 for 3-month blood test. We are on the keto diet of 20 grams of carbs a day since Saturday. I was regular 2 times a day. Now I'm every other day with a fiber supplement and I feel good. My wife was every 2 to 3 days, but now she's constipated. What do you suggest she does to help her?
Okay. The high fiber diet. So stay on the ketogenic diet, eat all those free foods. You can add a fiber supplement, but adding a lot of fiber to your diet is a really good idea, and that's where you get all of the lettuce and broccoli salads and peppers and cucumbers and tomatoes and all the stuff that you have, the list of free foods that we have, because a high fiber diet is going to make a big difference. And yes, constipation is a terrible thing, and it's not good for you either. It's really a good idea to get things moving better. Adding a supplement, some of the fiber supplements that are best are like inulin is really good. That's the chicory root extract is a really good fiber supplement for people who have chronic constipation. And because it feeds the good bacteria too. So it's not just fiber to move things through like the psyllium seed. It actually feeds good bacteria. So you got double benefit there. The other one is artichoke, the artichoke fiber. Those are 2 really good sources if you want to add fiber to improve that constipation.
Okay. Coney had mentioned that he was having a hard time. You know what? Actually, I say these names and I don't know if it's right. It could be Connie. I'm not sure. But I'm having a hard time not eating and only drinking juice, bone broth, and water. Commented back and said she is drinking cranberry juice for kidneys, I believe. And so I guess I'm assuming that you're fasting.
Oh.
and just
Okay.
and having a hard time with that.
Oh, okay. Wow, that's pretty good. So I just read a book recently called The Fasting Cure by Sinclair Lewis. Sinclair Lewis is a Pulitzer Prize winning author. He wrote The Jungle, which is about the meat industry, and that's what started our FDA 100 years ago. So that's how old this book is. It was written in I think 1910. And he talks about how he could cure just about everything with fasting, and how many different types of illnesses, including like tuberculosis and all these illnesses that we think of today as, oh, we can give an antibiotic for that, but they didn't have that back then. So and so they would use fasting and cure just about everything with it. So one of the things he says in that is I find that when I eat small amounts or drink broth or something like that, anything but water, that I still have a hard time with it. I have hunger all the time. Whereas if I'm just drinking water, by 3 days or 4 days, my hunger goes away. And then I'm not even hungry, and I don't even care to eat food, and I'm fine. I just go along about my day, and I got my water, and I'm good. So you may find that eating small amounts is counterproductive, that it's like, it makes you ravenously hungry because you have a little bit, and now, okay, like, where's the rest of it? whereas if you shut it off and you train your body just to use fat, the fat on your body, then you're getting all your energy from your own fat, and then there's no like hunger. There's no, I don't need to eat because I got all this extra calories that I'm burning up. So that's that. And you may want to read that book. It's kind of interesting. That it's called The Fasting Cure by Sinclair Lewis.
Okay. Someone is asking if the number 220 for cholesterol is the same in the US or same in Canada.
Gosh, I don't know what units Canada uses, but I think they do. I think they use the same units. So the cardiologist will tell you under 200 is best, and the lower the better. Because if you look at heart disease goes down as cholesterol goes down, but the death rate goes up as heart disease goes down. So you die from other things. And that's the point. So the cardiologists are so narrowly focused on the heart that all they can see is lower cholesterol leads less heart disease, and that's all they look at. But they don't look at the death rate going up. Like in 50-year-old men, if their cholesterol is 120, they have triple the death rate of the average person. So it's not. It's not necessarily that lower is better. So I think in Canada, I think they use the same numbers.
I'd have to Google that one. Okay. Terry said I had breakfast and my numbers are good. And then I start being mobile, working with something for a little bit. And then I get a flickering in one eye and sometimes both, followed by a headache. Then when I eat something, it goes away.
Okay. That could be low blood sugar, hypoglycemia. But remember that there's absolute hypoglycemia, and then there's relative hypoglycemia. So absolute hypoglycemia is when somebody's like 40 or 30, when they really have low blood sugar and their heart doesn't work right and their brain's not working right and all of that. And then there's relative hypoglycemia, and that's where your body's used to having this level. And your glucose transport proteins that bring the sugar into like the nerves, the brain, the heart, the kidneys, there's fewer of them because your blood sugar is really high. And then you drop your blood sugar down, and now you're only getting a trickle of sugar into these tissues, like nerves, for example. And so that might be hypoglycemia, relative hypoglycemia. In which case, it's actually okay because so even if you test and you say, well, I was 100, But if you're used to being 200, all of a sudden you drop to 100, you could still get symptoms. So just to let you know that actually that's okay. They've done research on that with rats, and they drop their blood sugar into the 40s. And what happens is over time, they start making more glucose transport proteins so that the set point can be lower. The sugar set point can go down to a normal level.
All right. This is so good. So we get all these questions, and every week
the body's so awesome.
it is. It's just every week we just keep learning,
awesome.
and it's so good. I love this. Okay. And I have like a list of about 20 books that I need to read just from these webinars. So I have some work to do. All right. Callistus says, I have had diabetes for 10 years. I was on Metformin, max dose, Forxiga, 10 milligrams, and 30 or more of insulin. I have been on the solution kit for over 6 months. My blood sugar numbers went down immediately upon taking Synachroma. I weaned myself off insulin in 2 weeks and Metformin 1 month. My A1C went from 9.6 to 8.2. I moved on to phase 2 and found my blood sugar stayed better with a few more carbs. I was not able to get off Forxiga. My A1C went up a little to 8.7, but unfortunately my LDL was up to 5.08. So my doctor put me on rosuvastatin. I try to eat very high fiber, but 2 eggs a day and lots of low fat meats. My questions are, how important is it for me to be trying to get rid of Forxiga, and any advice on getting my LDL down on the keto diet?
Okay. So that's really interesting. So you added a few carbs, and your blood sugar was better, and that may have something to do with the Forxiga. Forxiga is something that causes you you can't reabsorb the sugar that's released in your kidneys filter, and the water, the proteins and everything, the cells stay in there, the water comes through the kidneys. And then on the other side, it gets reabsorbed, and the kidney will absorb everything you need and leave out everything else. It's kind of a cool way of filtering when you think about it. I think, okay, so I need that amino acid, I need the sugar, I need the salt, I need the potassium, and then it absorbs everything you need, and whatever else happens to be in there, it just, you go out in the urine, right? Then that's that way the kidney doesn't have to know, oh, that's bad, that's bad. That doesn't have to know all the bad things, just the good things. So it's pretty cool. So what Forxiga does is blocks that reabsorption of the sugar so that you pee out the extra sugar so that it can't be reabsorbed. And so all that is excess sugar. So it may be just that you're eating too much, that because you said you're getting, good fiber and all that. So it might be just too much for you. And we're all different. Some people need a 1,000 or 1,200 calorie a day diet. Some people need a 2,000 calorie a day diet. And everything's different. So just being on the ketogenic diet doesn't necessarily fix all of those things if you're still eating too much. Remember, we talked about this before about proteins. If you're eating a lot of proteins and that causes you to release more insulin, then you can get insulin resistant from the fat causing insulin resistance. That's what it does. And then the proteins can be made into sugar. And so you could actually raise your sugar on this perfect, carnivore diet where you're eating nothing but meat, for example, or a good ketogenic diet. So I think in that kind of a case, you still have high blood sugar, which is why you can't get off the Forxiga, because you're excreting that extra sugar. And then I think that if you just decrease the amount of food that you're eating, like eat 2 meals a day, or even 1 meal a day, do that intermittent fasting kind of thing, on the ketogenic diet, I think that would be very helpful. And then decrease the proteins and fat and increase the fiber. And that should help a lot with the cholesterol and the sugar to bring them down.
All right, good stuff. Krish, so funny. wants to know if it'll make a difference if he has San Francisco style sourdough or South Dakota style. Well, I'm just going to tell you South Dakota style is going to be better. We'll
No,
just
no,
make
no,
that
no,
clear.
no, no. San
Make that
Francisco style, clearly better.
Make it from a starter and you'll be good. It won't matter.
My great grandfather came from Belgium, lived in San Francisco, and he started the San Francisco sourdough. He was a baker, and clearly San Francisco sourdough is the best.
That's funny. That's a funny question. Oh, that's good. Okay. Oh, we're almost out of time. All right. Cheryl says my doctor prescribed a statin drug for cholesterol. However, my HDL, LDL, and total are in range. They're good. He stated it's not because of my numbers, it's for my heart, and I will need it for life. At this time, I have no heart problems. Type 2 diabetes, newly diagnosed.
Okay, so part of the marketing department for Pfizer was to look at could lowering cholesterol be helpful for people that have diabetes? Well, if you think of what type 2 is, it's a metabolic syndrome, and it's a whole syndrome of things. It's not just one thing. So when you have high blood sugar and you have a lot of insulin is a growth hormone, and it tells your liver to make more cholesterol. So overall, when they did studies on large groups of people, they look at that and they say, well, it's helpful to lower cholesterol in people that have this metabolic syndrome, right? And it makes perfect sense. But does that research of groups of people apply to individuals? No, that doesn't apply to individuals at all. So you have to, so what I do is different. Instead of looking at the overall general population, I look at individuals and I ask the question, does this individual need this program? So if you don't have heart disease, your cholesterol is fine. Remember, the death rate from cholesterol drops as you get up to 120. You get a lower death rate as you get up to 120, and your death rate goes up as you go over 130 or so. So that around, I'm sorry, 220. So the 220 is the perfect number. And if you drop your cholesterol, your death rate goes up, even if you're taking a statin. So your cardiologist is talking about, you need this for your heart because the heart disease drops, but then the death rate goes up, even though it's not from heart disease. So I would say it's the risks outweigh the benefits in that kind of case. So talk to your doctor about alternatives. What can I do instead? I know that the company is advertising to doctors and telling us that we have to increase that we have to put everybody on a statin. In fact, I had one cardiologist tell me, yeah, they should put it in the water and everybody should drink it all the time. This is like something that's that important that it would improve heart disease in everybody. However, that's not really true, but that's what the advertising is. So that's what the doctors get from the drug companies.
Wow. Okay, final question from Robert. If adding more insulin is wrong for type 2, why are doctors prescribing insulin injections?
Okay, the why is a great question. I hope you always ask why questions. Everybody, all of you should be asking why questions all the time. Why this? Why that? Why this? Why that? Why? That's the best question to ask. So why do doctors prescribe it if it's the worst thing you could do? Because it's making you more insulin resistant. Well, so did the drugs that you're getting. Most of them cause more extra insulin to be produced, so you're causing more insulin resistance over time. Because the focus is different. If your only focus is blood sugar, that's all I care about is blood sugar, it makes perfect sense. Because all I care about is right now, this moment, I'm going to lower the blood sugar. And I don't care what happens in the future, and I don't care what happened in the past. All I care about is in this moment, what's the blood sugar? And I got to get that blood sugar into this range and keep it there all the time. So if that's your focus, then it makes sense. And you go, oh, right now my blood sugar is 200. I need insulin to drop that blood sugar. And then that's will have effects later on of raising the insulin resistance. So it's not a good idea long term, but it's a perfectly logical thing to do for if you're looking short term.
Today's Fixed Blood Sugar webinar is sponsored by Synachroma, our best-selling advanced blood sugar support formula. Now, thousands of people around the world are taking Synachroma every day as part of their program to fix their blood sugar using natural ingredients that simply work. Now, Dr. Saunders formulated Synachroma to meet key nutritional deficiencies that most people have unknowingly suffered from for far too long. With Synachroma, you get a blend of 6 key ingredients. The perfect combination of chromium, vitamin D3, and vitamin K2, which it's important to take those two together, selenium, vanadium, and our 10-to-1 cinnamon bark extract. Now, if you're not already using Synachroma, I highly recommend that you give it a try and see how it helps your energy, your weight, and your blood sugar numbers. You can get Synachroma at bartonnutrition.com or on Amazon. If you get it at bartonnutrition.com, you can enter the coupon code webinar25 and you'll save 25% off at bartonnutrition.com. But I realize some people like to go to Amazon as well. So anyways, Synachroma, highly recommend. Now let's get you back to the Fixed Blood Sugar webinar.
Okay. All right. Dr. Saunders needs to head out. Thank you so much, all of you, for joining. Right. He's going to go see patients. We will see you guys here, same time next week, same place. Have a wonderful week, you guys. Thanks for joining.